and welcome. You're watching FYI. I'm Rishika Barua. WHO's chief scientist, Dr. Soumya Swaminathan, has said that India seems to be entering some stage of an endemic. Now, as misleading as it may sound, it doesn't mean the end of the pandemic. On the contrary, it means something that doesn't quite end. In this case, a disease or an outbreak that is actually difficult to get rid of, but something that we can live with. On FYI today, we try and decipher this endemic stage. What does it really mean? And most importantly, is India really in the endemic stage? So let's try and break this down. Is COVID-19 endemic in India, and what really does an endemic mean? Well, an endemic is essentially an outbreak that is present at all times. It is a disease that persists and it is difficult to get rid of. It's a disease that causes symptomatic infections but is not necessarily as deadly. A disease that is restricted typically to a geographical area or a region, and the rate of spread of infection is something which is controlled and predictable. Now, for example, malaria, chickenpox, viral hepatitis, AIDS, Ebola, dengue, chikungunya, tuberculosis, these are all examples of an endemic. Now, dengue, chikungunya and tuberculosis, the last three examples are actually specific to India. So, we keep hearing of these diseases in India. This is essentially what an endemic disease means. Now, let me try and break down for you the difference between what is a pandemic and what is an endemic. Well, in a pandemic, the main difference is that in a pandemic, the disease growth is exponential, whereas in an endemic, the disease growth is under control. In a pandemic, there is a very high growth rate of numbers, and as far as an endemic is concerned, it is a more predictable growth rate, and the disease spread is not very high, it's very controlled. Now, in a pandemic, cases grow on a daily basis. So, you will see a daily rise in cases. It essentially means that the daily infection today is greater than the infection yesterday. In an endemic, the outbreak is consistently present. That means that there are X number of cases that are consistently present in that constrained geographical area. In a pandemic, the virus affects several nations and populations, which is what we are seeing right now. The COVID-19, for instance, is a global pandemic. An endemic, however, is limited to a particular region. Think about the examples that we stated, which were India-specific, which is dengue, chikungunya and tuberculosis. Well, to try and break this down further and also to understand what this really means for India, Dr. Shashank Joshi, member of the COVID-19 task force in Maharashtra, joins us. We have Dr. Chandrakant Lahiria, epidemiologist and health system specialist, who will be with us in just a bit. But Dr. Yatin Mehta, chairman, Medanta Institute of Critical Care, is also with us. Dr. Joshi, to you first. Is India really has India really entered the endemic stage of the COVID-19 pandemic, of the COVID-19 outbreak? Do you agree with that assessment?
No, currently I don't agree with that assessment. Some geographies of India, there might be some endemicity. For example, the city I live in, Mumbai, we now know that probably COVID is endemic here. And we have never seen numbers below 300 or 200. So to a great extent, we know that it is endemic from that standpoint. But strictly from a public health standpoint, India as a geography is a very large geography. It has a lot of heterogeneity. There are some spots where COVID will become endemic. Mumbai may be one of them. I think it is too premature to call it endemic right now.
Okay.
Because we are just on the low ebb of the second wave. In places like Delhi, for example, there is no COVID at all right now. I mean, it's as good as gone. So, to say that India COVID is endemic would be inappropriate and premature. Maybe after another couple of years, we might be able to say it is endemic. I think in a year and a half to say that COVID is an endemic in India is inappropriate. But some geographies which are population dense, high migration, high mobility, high degree of vaccinations may have endemicity creeping in very slowly and clearly.
Right. I think that's very interesting. You're saying that India per se is too big a country for us to categorize it as an endemic phase right now, but you're saying certain pockets of the country could very well be in that phase. Dr. Mehta, as somebody who's been at the front lines of this COVID-19 pandemic, what does it mean for critical care? When you say that India has entered an endemic stage of the pandemic, something that we're now going to have to perhaps learn to live with, what does this mean for critical care?
See, what it means, Rishika, I think your definitions of or explaining it, you've done quite well. I must congratulate you on the what is endemic and what is pandemic and what is sporadic. So it is, as I would agree with Dr. Joshi, that at the moment it is not endemic, but it is heading towards that. As Dr. Swaminathan has already clarified that.
Okay.
And certain areas, see, India is a geographically multiple, it's like multiple continents, multiple countries together. It's too big. It's bigger, almost as big as Europe. So now what it means to me, coming to a specific question of critical care, is that if it is endemic, it is easier to deal with it when the numbers slightly increase. The numbers are not going to increase like what it did in the first or the second wave, because that was a pandemic or epidemic, whatever you call it. So when it is endemic, we learn to live with it, and we have enough the facilities or enough infrastructure and manpower to deal with it when a few numbers increase.
Yes.
So the first and second wave did give us that opportunity to prepare for the eventuality. And I do not think it is going to overwhelm us, because it is, I think certain areas are becoming endemic where the seropositivity has increased. So I think we can deal with it quite easily in the critical care also. Like what happened with the swine flu.
Right.
A few years back when it came, it was epidemic in certain parts of India, and we were completely overwhelmed. I mean,
Yes.
it was a panic and multiple,
That's
large
very
number of
interesting,
deaths.
because what you're essentially saying, Dr. Mehta, is that as and when different parts of the country enter this endemic stage of the pandemic, it also means that our healthcare system will be better equipped to deal with it. We won't necessarily see the kind of spiraling numbers that we did in the second wave. But Dr. Joshi, it's very interesting that you say that it may be premature to say that we are in an endemic stage, especially given the fact that numbers once again are rising. Kerala is a worrying story. The ICMR has said that many states are seeing the onset of a third wave. In the light of rising numbers, how does this endemic argument fit?
So right now, no, I don't think we should go into splitting whether it's endemic or pandemic. Currently, we are still in the pandemic, in the second year. And I would say that right now, our first target is to ensure that masking and vaccination is completed. We have 2-3 geographies like Kerala and Northeast, which are still having very high test positivity rates. Maharashtra is still having 5-6 districts like Sangli, Solapur, Satara, Nagar, Pune, which are still having their districts of concern. So we need to ensure that that so-called thick tail of the second wave is eliminated from these geographies. And that is our first priority.
Right.
Second priority is we need to go to a zero COVID number. That is no deaths from COVID. And we need to ensure that the severe and critical cases of COVID are mitigated.
Right.
Those are our current goals from the clinical and public health standpoint.
Okay.
And I think therefore I don't want to get drawn into this argument whether it is endemic. Country
Okay.
for sure is not endemic, but
Okay.
I'm certain that Dr. Laharia, my good friend, will have a comment on that.
The reason we've drawn you into this conversation is also to dispel the myth that many people believe an endemic means the end of the pandemic. It's quite to the contrary. It means that it's
absolutely.
something that's here to stay. So, the word in a certain sense can be misleading, and I think it's important to dispel some of those misnomers as well. Dr. Chandrakant Laharia, you've written about the endemic stage in your book as well, a book that you co-authored on the COVID-19 pandemic. Can you break down for our viewers what are some of the characteristics of this endemic stage? And would you agree that it's where India is heading, or at least certain pockets of India are heading right now?
So, first thing we need to remember is that as long as world is in the pandemic, no country can say that we are endemic or any different stage. The terminology pandemic itself means that a particular disease condition is affecting all countries of the world, so we should not think. India can claim, or any country can say that when they are out of the pandemic, when global bodies such as World Health Organization or any other body say that pandemic is over, and then only the pandemic will be over, and then country can classify themselves. That's one. Second part is that we have seen in the past that usually the terminology outbreak, epidemics or pandemics is used for either the new pathogens or pathogens which have crossed the geographical boundaries, like outbreak localized area, epidemic multiple countries, and pandemic many countries. It is not linked to the severity of disease. So disease can be very mild, moderate, or severe, but if it's a geography is bigger, then it's pandemic. Endemicity means when a country achieve a low level of sustained transmission. For example, HIV/AIDS started as an outbreak, become epidemic. It is a pandemic, it's silent pandemic, but now it has become more of an endemicity. So a disease which starts new, and then in a new setting where it is not occurring, it is classified as outbreak or epidemics. But once it is sustained transmission, it's endemic. For example, dengue or chikungunya are endemic in many countries. But in some countries such as Europe, even a single case would be considered outbreak, because in those settings it's not there. A case of Ebola in Africa may be considered endemic in some settings, or maybe increase in outbreak. But any case in India would be considered outbreak or epidemic if it's a new setting.
All right, I think that's a very important clarification that you've made, that an endemic stage doesn't necessarily have much to do with the severity of the disease, but it does have to do with the geographical concentration of the disease, which essentially means that it's not something that is spreading world over, but then it is restricted to certain pockets, regions, or countries. Well, what does this endemic concept mean for a disease like COVID, where there are variants that are emerging and one isn't entirely sure if our current set of vaccinations is going to be adequate enough, or rather good enough, to deal with the emerging variants? I'm going to pose that important question to our panelists, but that's going to be on the other side of a short break. Stay with us. We'll be back with more. Welcome back. We are talking about what it means for a country or a region to enter the endemic phase of COVID. We're also asking the question whether India really is in an endemic phase of COVID-19 at the moment. We have a panel of experts with us. Dr. Joshi, if I can come back to you at the moment, how do you look at this entire endemic argument in the light of the new and emerging variants? We know that the only protection we have against the COVID-19 vaccine, apart from COVID-appropriate behavior, is vaccination. We are still unsure of, what future variants are going to be and whether vaccines will be effective against them or will need to be tweaked.
So, Rishika, three things we need to understand. First is, COVID is a new virus. So, we are going to get some degree of mutation, but it's a slowly mutating virus. And there might be variants of concern, variants of interest. Some of them may be sinister, some of them may be innocent. In fact, as the pandemic will go further, probably the intensity and the virulence may come down, is what we hope and pray. In fact, if you see SARS-CoV-2, it totally disappeared from planet Earth. Though some sporadic cases were seen. MERS to vanished. So it is unlikely that will happen with COVID. That is one thing clear. Second is this endemic argument. I would not go from a public health definition. All it means is that we need to learn to live with COVID. That is something for the at least next 2 to 3 years. Yes, current vaccines are experimental vaccines, early emergency use vaccines. Yes. They are preventing death and severe disease. That is clear cut. The data is now very clear cut across the world that they prevent death, they prevent severe disease and hospitalization.
Dr.
We
Lahiria,
need to do sterilizing antibodies and sterilizing vaccines, which will come. I think the nasal vaccine is being investigated in India and abroad. We will get better vaccination. So I think the word endemic is, it may happen, but I think right now it's premature, if you ask me.
Okay, it's premature. But Dr. Chandrakant Lahiria, for many people who ask, how does this end? How do we ever see the end of COVID-19? Is endemic, therefore, an adequate explanation? Is this how it will end, with us learning to live with COVID-19?
Well, endemicity is a epidemiological approach to say that. But for layperson, it would mean that the number of new infection would come down and would fairly stabilize. Like, we can look at from the two perspectives. From the individual perspective, it would mean that the risk of getting infection and then severe disease would be fairly low, because people will be vaccinated. the virus would still be transmitting in the community. So some individual might be getting infected, but they would not be falling severely sick. The hospitals will not be overburdened. So that will be from individual perspective. Okay. Also, it's very likely that people might have voluntarily need to wear mask, but that's, I'm talking about 2 years or some period later when pandemic would be declared over. That period of time, people may continue. Some high-risk people might have to continue with wearing masks, but other people might not require. But things would be changed. From the health sector perspective, what we need to remember that as long as virus is circulating, we need to do the public health surveillance, which essentially means the testing facility should be available. There should be ward in the hospital, which should be taking care of all of these things. And some of the learnings, some of the challenges which we have identified would continue. But as Dr. Joshi said, that this would unfold over a period of time, we definitely do not know. And virus has definitely surprised all of us. But things would be really improved and low level of transmission we expect.
Right. Does it also mean, and Dr. Mehta also raised that point earlier, Dr. Lahiriya, if you can just quickly respond to that, does it also mean that it then becomes an outbreak or a disease that doesn't necessarily burden the healthcare system like COVID-19 has? If you look at the chief difference between a chikungunya and a dengue, people still may require hospitalization, but it doesn't necessarily burden the healthcare system like COVID-19 has.
So I think you gave a very good example of chikungunya, dengue. We know that these infections, these viruses are there, and then vectors which carry them are there. So they are endemic diseases. But once in a while, for example, in Delhi, every 4 years, there is an outbreak of chikungunya. So once that baseline is disturbed, which essentially means if there is a high rise on the number of cases in a limited geographical area, then it would be called outbreak of dengue. And then if it's a number of geographical area, it is epidemic of dengue. So something similar may still arise, that virus COVID-19 could become endemic, but if there is a rise in the cases, at that point of time, we will call it outbreak. Or if there's rise in the cases in multiple states, it will be called epidemic.
Right.
So even with the endemic, there is a possibility of outbreak and epidemics in the future of COVID-19.
Okay. Dr. Mehta, does it also mean that we'll have a short cure? Right now, we are still in the experimental stages when we talk about a cure.
See, half the drugs which were introduced in the beginning of last year have been thrown out of the window. So we all were learning as the disease advanced and more research papers came out. So every day we are learning. I mean, yes, a lot of drugs were not used. A lot of new drugs have come up which are efficacious. And I'm sure we'll come out with something. The time period is very short for a disease history for 1.5 years. The time frame is very, very short, not only for the treatment modalities, but also for the vaccinations. I mean, a history of mankind's vaccines has not developed in 1 year's time. So that's why I think things need to evolve.
Yes.
And people ask me, when should they take the third dose? When should they take the booster? All these questions are unanswered. So, but I would just like to add one thing to what Dr. Joshi said, that not only the vaccination will decrease the incidence of severity of the disease and mortality, but also once they get the disease, the viral load is much less, so they are less contagious to other people, to the population.
Yes.
So everybody should get vaccinated.
And also, stop the variants from emerging, which questions, and raises more questions about the vaccine. I'm completely out of time, but this has been a fascinating conversation. I think the biggest takeaway is that the endemic doesn't mean the end. It just means something that we learn to live with. Masks are here to stay, and getting the COVID-19 vaccine is absolutely essential. Thank you so much, gentlemen, for sparing your time and being with us on this edition of FYI.